Now, I just want to split it and quickly talk about these two important words you hear around the surgery theater. Okay, you hear a consultant saying something like, okay, this is an elective surgery. Why you hear that calling you guys, and some are saying this is an emergency surgery. So, just want to spend time and talk about the differences between an emergency surgery and elective surgery. Okay. So I think let's go directly. So we'll talk about emergency surgery before we talk about elective surgery. So it's your responsibility to combine everything we're talking about. Then you bring out your differences, right? So emergency, anything emergency is actually a red ping pong, all those ambulance noise on the road. So it's an unplanned procedure and it's done urgently. Okay, so as a doctor, you might have come to the hospital, you have actually served your whole day in the hospital. As you're just stepping home, they are saying, bro, somebody just came to the hospital right now, the head is almost apart and it's only you that can do this. You have to come back, it's an emergency, right? So it's usually life-threatening. If it is not life-threatening, they'll admit the patient, they'll stabilize them, they'll wait for you tomorrow. Do you understand? So it's life-threatening, or it's a medical condition that has been known, but it just exacerbated all of a sudden, so it's acute. Okay, so it's performed immediately or within just few hours. If not, patient might pass away. Examples, not exhausting everything. We're just saying, for example, so appendectomy, if it is ruptured, traumatic injuries like car accidents, ulcers, the ulcerated, so you're having leakages. Do you understand? So risk is higher, complication risk due to limited preoperative preparation and unstable patients. So decision is often made by medical professionals without patients due to urgency. Of course, most patients are even in coma or something, all right, or they are too much pain, they don't even know what's happening around them. So elective surgery now is a type that is planned. They are medically necessary but not urgent. Okay, they might even plan you an elective surgery. In our hospital, you see they're planning patients surgeries for 2 months ahead, 3 months ahead. You understand, that kind of thing. So it's scheduled in advance. It's allowed, so they now allow time for. Yeah, for us in Africa, money is a problem. Not really. I'm not trying to say the other. So you also give the patient chance to actually prepare financially and all of that. Examples, things like hernia, joint replacement, cosmetic surgeries, like me making you Botox, cancer resections. So benefits, there's lower risk of complications because the surgeon, funny enough, they go back to study more on your condition. So when they come in, everything is always perfect if they are serious surgeons. Okay, so it involves shared decision making. So the patient will have one or two things to always say like that.